Dear students, welcome back. In this session, we are going to discuss about the structures which are present in the second layer of the sole. So normally the second layer of sole consists of two muscles and two tendons. The tendons are the flexor hallucis longus tendon and flexor digitorum longus tendons. So we have already discussed about these two muscles and their insertion. So these two muscle tendons which pass under the foot, isn't it? Under the foot, and this flexor hallucis longus, which is going to insert at the base of the distal phalanx of the great toe. Distal phalanx of the great toe. Okay. If you see this flexor digitorum longus tendon, this tendon crosses the flexor hallucis longus tendon, and it moves from medial to lateral side and splits into four tendons for each lateral four toes. And these tendons finally inserted into the distal phalanxes from second to fifth. Okay, so these are the insertions of flexor hallucis longus and flexor digitorum longus. Now, coming to the muscles, it consists of two types of muscles. One is called as flexor digitorum accessorius, which is also called as quadratus plantae, and next one is the lumbricals. There are four lumbricals which are seen in the second layer of the sole of the foot. Now first we will see the origin of flexor digitorum accessorius. So it is having medial head and the lateral head. So medial head arises from the medial surface of the calcaneum, and the lateral head arises from the tuberosity of the calcaneum. Tuberosity of the calcaneum. If you see the insertion, this muscle is going to insert on the lateral border of the tendon of, so here this is the lateral border of the tendon of flexor digitorum longus muscle. So this is the insertion. Okay, here this is the lateral border. Now if you see the nerve supply, this one is supplied by the lateral plantar nerve. Flexor digitorum accessorius is supplied by lateral plantar nerve. Okay. Now if you see the action, it straightens the oblique pull of the flexor digitorum longus. It can flex the toes. It can flex the toes through the tendon of flexor digitorum longus. So now coming to the lumbricals. So there are four small lumbricals that take origin from the tendons of the flexor digitorum longus. Okay, the first lumbrical, here you can see the first lumbrical, which is originating from the medial side, of the tendon of the second toe. And if we see the second lumbrical, here you can find the second lumbrical. The second lumbrical will take origin from the contiguous sides of the tendons second and third. Okay, so for example, if you see, this is the tendon for the second toe, tendon of third, and tendon for the fourth and fifth fingers. Okay, so the first lumbrical is originating on the medial aspect of the tendon of the second toe. And if you see the second lumbrical, which is originating from the lateral aspect of the second and the medial aspect of the third tendon, forms the second lumbrical. And third lumbrical is also same as the second lumbrical, from the contiguous sides of the third and fourth toes, and fourth lumbrical is also originating from the contiguous sides of fourth and fifth toes. Okay, these are the origin of the lumbricals. Okay, so now if you see the insertion, each muscle tendon, so each one is going to insert. So before insertion, this tendon passes backwards on the medial aspect of each toe, on the medial aspect of each toe, on the medial side of metatarsophalangeal joints, and is inserted into the medial basal angle of the extensor expansion for that digit. Okay, so that means each tendon will passes medially by the side of the metatarsophalangeal joint and comes to the dorsal aspect, and which finally inserted into the extensor expansion. Okay, so that is the insertion. Okay, for example, the tendon of the first lumbrical is inserted into the second digit, second lumbrical inserted into third, fourth lumbrical inserted, third lumbrical inserted into the fourth digit, and fourth lumbrical inserted into the fifth digit. And these lumbricals are supplied by plantar nerves. So medial plantar nerve supplies the first lumbrical. This one is supplied by first medial plantar nerve, and the remaining lumbricals, the other lumbricals, second, third and fourth, are supplied by the lateral plantar nerve. So if you see the actions of these lumbricals, they maintain extension of the interphalangeal joints of the toes. So these are all about the muscles of the second layer of the sole. Thank you.